Welcome to the True Hunt, and today we have got Dr. Ashok Rattan with us, who has been an ex-laboratory director in the Caribbean with WHO, and also he is currently a medical committee chairman with the Redcliffe labs, and he's going to discuss with us the SARS CoV-2 variant Omicron JN.1, which has been all over in the news now, and our honorable union government has recently done a review meeting on this to update the situation regarding this variant of COVID-19. Sir, welcome to the True Hunt. And my question to you is, first of all, tell us that what is SARS CoV-2 variant Omicron JN.1 all about?
As you know, that SARS CoV-2 was the virus, which is the Wuhan virus, which caused the pandemic and which we had suffered for the last 2 years or so. We also then knew that the virus, because it's an RNA virus, it mutates. And when it causes enough mutation, it becomes a different strain. And then WHO started classifying that if there was sufficient change in its infectivity, in its transmissibility, and its severity, then it will become a different variant. And a variant will be variant of interest. That means we need to monitor it very closely, or variant of concern, which for public health is very important. And in the last 3 years, since we have been struggling with this COVID-19 disease or the virus SARS CoV-2, we've had 5 variant of concerns. And I think in India, nobody can forget how we went through the Delta variant. There are also 8 variants of interest. Variant of interest have not caused the same concern, but they need to be watched. And JN.1 is now the 9th variant of interest, which WHO has recently added. It made its appearance somewhere in September, especially when it can be recognized only when you do sequencing, whole genome sequencing of the virus. Then you find that Omicron, which started from South Africa in 2021 and which was milder. So many persons in India lost interest because Omicron was milder, it was spreading faster, but it was not causing serious infection. It was not increasing the admission to hospitals. It was not causing death. So India started focusing on other health problems than on Omicron. In the West, of course, they use next generation sequencing or whole genome sequencing as a routine method of surveillance. So they noticed that more and more isolates of SARS CoV-2 are of the JN.1 mutation, which is an offshoot of Omicron. So it's a grandchild of Omicron. Omicron first became BA2, then from BA2 it became BA2.86, and from 2.86 it has now become JN.1. And in America, where they do routine sequencing of all the isolates that they get, then they have noticed that from 7% in, say, September, now about 25-27% of isolates are JN.1 isolate, and they're increasing. And now there's a paper which is in preprint which indicates that JN.1 virus, actually this variant has increased transmissibility. Its RO value is higher than any other. So it is projected that soon it will be the dominant isolate around the world. Second one is that it has immune escape. So even if you have had vaccination or you have recovered from previous infection, you can still get infected. The good point is that its affinity for human ACE2 virus, ACE2 receptor, through which it enters into the cell, is less. So it will cause infection, it will spread from one person to another person, but it will not enter the cell too well. As a consequence, the infection it will cause is very mild.
Less impact. Sir, I would like to ask you, before going to the simple questions for the understanding of laymen's, and recently the situation was observed by the Honorable Union Health Minister, COVID-19 situation, this virus I'm talking about, which we are discussing. Sir, in that, I would like to read out from the report that as per the Union Health Minister, stressed the need for collective efforts between the center and the states to deal with the emerging situation in the spirit of whole of government approach. He directed for strengthening the surveillance system for whole genome sequencing of positive case samples to track the variants through Indian SARS CoV-2 Genomics Consortium network to ensure timely detection of the newer variants circulating in the country. So, sir, how you see this statement and how the surveillance system would be working in this scenario? Please, can you throw a light?
I think it's very desirable, but I think he's focused on the highest part. When you want to reduce the risk, there are various hierarchies of risk reduction. First and the most effective is elimination. Now, that is eliminating the virus is not in our hand. That is in the hand of God. So, okay, we can say elimination is not something that is there. The second one is substitution. Then the nature is substituting a virulent virus with a very mild virus. So Omicron as it is was nature's way of giving us vaccination, and JN.1 is now a milder virus, so it's giving natural vaccination. What we can do is engineering controls, then administrative controls, and finally the least effective control measure is the PPEs, that means personal protective equipments or things that we were wearing, which is essential. This is each one of us has to play a role, and I agree that there should be surveillance system in place and we should use the surveillance system. But I think one would be surveillance, not only the whole genome sequencing should be used, because JN.1 can only be identified by whole genome sequencing. Otherwise, it's like any other SARS CoV-2 virus and any PCR would pick it up. Now, what is required is that before the press sensationalizes the increase in number of cases, they should also say whether there is increase in positivity, there is increase or change in hospital admissions, is there change in visit to the emergency room, is there increase in death. This will put in place. If there is no change, or because of holiday seasons, maybe there's a decrease in visits to the hospital, it means the virus is mild and people need not get worried too frequently. We also know that because of COVID situation, now we have at least 3 drugs available. And in the West, they have had upgraded vaccination. So the new vaccine, which was focused on XBB variant of Omicron, is effective against, it has cross protection. We do not know whether the original Wuhan vaccine, which was made into Covishield or COVID or Covaxin, would be able to offer us protection. But the virus itself is very mild. So I think it stands to reason that whenever we are in public, we should be wearing mask, we should maintain distance, we should wash our hands. And when we are sick, Indians have a habit of coming to office even when they are sick. So I think they should take leave and stay at home and work from home rather than be near persons if they are sick.
Sir, my question to you now is for layman people to understand, of course, as you talked about the things to take care of, like wearing masks and stuff. Sir, what can I do as a layman to protect myself from infection? So how would you explain it, sir, please?
Increasing awareness is one of the most important part. And I think in the rest of the world, there has been a talk that we should be fearful of triple endemic. There are 3 viruses which have similar features. COVID-19 is one of them, but influenza and RSV also have same clinical features. They also peak during the winter and they can cause morbidity and mortality. In this, RSV is the one which normally affects children, and influenza is something which kills more than normal. It kills persons who are below 5 years of age or above 65 years of age. And vaccines are available, and Indian data indicates that after monsoon, there's a peak of influenza, and during winter from January to March, there's another peak. I think besides worrying about JN.1, we should also be worried about influenza and for children about RSV, because the clinical features are the same and the same effective. Suppose we wash our hands, we wear the mask, we keep distance, we stay at home when we are sick, would help in preventing spread of the virus.
Sir, my next question, of course, it's related to the symptoms on JN.1 COVID-19 infection. So could you elaborate on that, please?
Actually, symptoms of COVID, they are no different than symptoms of influenza or RSV. As they said, there would be running nose, there will be cough, there will be a sore throat, there may be some some fever. The distinctive features of COVID was loss of smell and taste. That was distinctive. The second one, distinctive of influenza, is that you feel you're knocked down. Real weakness occurs when a person has influenza. And if it is in children, then RSV is the one, and breathlessness, RSV is the one that we thought about. But all three viruses have nearly the same kind of common cold kind of symptoms. So if you are healthy, then you need not worry too much. If you have comorbidities, then you should take extra precaution.
Sir, I'll come to the vaccine part. As with the COVID-19, we were aware of the vaccination and we had taken the doses as prescribed by the doctors and by the government. So in this case, with the new virus, which is a variant of COVID-19, as you talk. So what kind of vaccinations would be available for the people?
JN.1 is milder form of Omicron. Omicron itself was milder. I know in our memory is Delta virus and how it ravaged through India. That's the fear that makes most of us decide. And even politicians are making sure that this time nobody accuses them of inaction. That is why they are maybe sometimes acting faster than they did in the past. Nevertheless, from the lab data, it indicates that this virus has the greatest immune escape, which will project that previous vaccinations based on Omicron may not be effective. Though, of course, Covaxin, which was whole virus vaccine, may still have some effect because Covishield was based on spike protein and there are about 31 mutations in the spike protein. So if you have antibodies as a consequence of Covishield, that may not be as effective as that which you have antibodies against Covaxin, because Covaxin will bind to other parts of the virus where mutation may not have. But there's no need of vaccination and there's no need of revaccination with the same vaccination.
But we could say that only precautions are needed to keep ourselves safe.
Yes, and I think knowledge is a good precaution. So as I said, that if press, when they are reporting about new JN.1, they should also say whether there's increase in hospitalization, increase in positivity, increase in admission into ICUs.
Sir, I would like to mention that as per the analysis which I discussed with you earlier, there was a line which I would like to read out. On the CDC website, while they talk about how JN.1 is surging and now accounts for some 29% of SARS CoV-2 viruses sequenced, they also mention some trends. Could you throw a light on the trends? There are 4 or 5.
Yeah, see, those are part of surveillance. Surveillance means being aware. And I think all, not only decision makers, but public should also be aware that there is no increase in hospital visits. There is no increase in emergency visits. There is no change in death. So that the number of viruses will increase. Common cold, it will be JN.1 would become the commonest virus, but there is no reason to panic. So this information would make us go about our work without interruption, without feeling panic, but at the same time, if it makes us start wearing masks, if it starts washing our hands once again, if it makes us stay at home when we are sick, I think those are good points. But surveillance, of course, is a continuous process. That is the price of staying healthy. So the price of staying healthy is being aware of what is happening and then be prepared to take action if things become bad.
My last liner to you that I would like to ask you that the surveillance process should be a continuous process, whether a pandemic disease exists or not exist in this.
Oh, yes, my pain is that we stress on the uncommon and forget the common. What is killing is tuberculosis. If the same resources were dedicated towards tuberculosis, we would make progress. We have 17% of the world's population, but 27% of world's tuberculosis, 27% of the resistant cases. And we keep talking much, but there's very little action to eliminate tuberculosis. So JN.1, which is harmless, even everybody is charged up. While tuberculosis, which can kill, we are not willing to. We do what Robert Koch used to do in 1882. 80% of diagnoses in India were made using Robert Koch's method in 2022.
This was Dr. Ashok Rattan with us, who has been given Abdul Kalam Award for his contribution to the health sector in the past as well. Thank you so much, sir.